we've had a crisis. We can see where the cracks are even more now than we did before. And so it really is about how do we fix the situation? How do we build back from what's broken? But also, I think there is an inherent sense of building resilience as well. For us to be able to do that, we need to address the root causes and ensure that the next time we have a pandemic, we are much better prepared in the work and the support for migrants. The pandemic has done a couple of things. One is it's exacerbated challenges and issues that pre-existed. We've seen how people have lost their jobs. You've also had people who are undocumented or have an irregular status who would have been impacted even more in relation to access to services because they don't have the right documentation. Workers have had to go without their pay, have had to leave countries without their pay. We can say that there have been some new challenges in relation to fatalities. We've had a lot of migrant workers and diaspora communities who've been at the forefront of fighting the pandemic in the health sector, in the public sector, and unfortunately in some countries they have suffered a disproportionate loss. In addition, you've also had in some countries hundreds and thousands of migrant workers who have been stranded. Some short-term measures that were put into place specifically to address the pandemic in the short term. These are also some of the solutions that civil society had been calling for on a much more long-term basis. Some countries finding a way to release people in detention. We've had some examples of countries that have been able to provide access to services for all migrants, regardless of their migration status. We've had those who've been able to provide migrant workers with some sort of regularization because some of the sectors that have the majority of migrant workers are actually essential services. And we can actually look much more at long-term legal pathways as opposed to temporary legal pathways, because the pandemic has shown us and has thrown up the challenges of people being stranded between borders. So reviewing the process of regularization, but also reviewing for legal pathways and really looking at how we begin to reset and look at labor mobility in this context. How do we support the movement of people across borders in seeking jobs? People will go to where the jobs are. Can we reset and begin to look at creating these jobs in the locations where people are? We're all working remotely. Can we create jobs where the supply is? So I think this really addresses the root causes of mobility. We want to ensure that everyone is able to access healthcare, health services, that they're able to access public services, and also that they will also receive the vaccine. A lot of the work I've heard over the last few days at our GFMD, how some of the experience has pointed to the fact that in supporting migrants during the pandemic, people felt that governments were missing in the implementation of the mitigation measures, and a lot of the support that they saw came from civil society organizations, came from other actors, but not necessarily governments. My expectation and hope is that we all understand who the different stakeholders are, what we all bring to the table, how we develop civil society and migrant agency, and how we ensure that our experience and our learning and the practice that we want to share is understood, but also is taken on board to plan together and to work together for the future. we're looking at public sector, you're looking at governments, you're looking at national and local governments, regional governments, but you're also looking at a private sector as well, and you're looking at civil society, including diaspora and migrant communities themselves.